Hello, my name is Dr. Lester Borden. I am the Prostate Cancer Medical Director for the Cone Health Cancer Center and a urologic oncologist at Alliance Urology Specialists. The purpose of this video is to provide educational information about prostate cancer screening for patients who may be considering getting tested for prostate cancer. Prostate-specific antigen, or PSA, is a blood test that has been used for the purpose of early detection of prostate cancer. PSA testing measures the level of this protein that is secreted by the prostate into the bloodstream. The PSA level may be elevated in men who have prostate cancer, but also sometimes may be elevated in other non-cancerous conditions. PSA testing to screen men for prostate cancer has been controversial. While there is evidence that supports a lower chance of death from prostate cancer for men who are tested, there are also concerns about the potential risks due to screening. While the actual blood test is not harmful, there is concern that some men diagnosed with prostate cancer will receive treatment that they may not need, as many prostate cancers can be very slow-growing and not always life-threatening. Some of the side effects of the treatments for prostate cancer can include urinary, erection, or bowel problems. So what should a man know about prostate cancer and the PSA test? Firstly, some facts about prostate cancer. Prostate cancer is the most common cancer in men other than skin cancers. Men in the United States have about a 1 in 7 chance of having prostate cancer during their lifetime. It is the second leading cause of cancer death in men in the U.S., with about 25,000 to 30,000 men dying of prostate cancer each year. Men who have a family history of prostate cancer, a father, brother, or son, have a higher risk of prostate cancer. African American men have a higher risk of prostate cancer and a higher risk of more aggressive prostate cancer. Many, but not all, prostate cancers grow very slowly. Whether a man who has prostate cancer will die of his cancer or something else may depend on many factors, including how aggressive the cancer is, how early it is detected, how effectively it is treated, how old the man is, and what other health problems they may have. Most men who have less than a 10-year life expectancy will not die of prostate cancer. Men who have regular PSA tests do have a higher chance of finding out they have prostate cancer. As expected, men who do not have regular PSA tests have a lower chance of finding out they have prostate cancer, but they have a higher chance of having more advanced cancer if they are diagnosed. It is important to understand that despite improvements in surgery and radiation therapy for prostate cancer, these treatments still carry a risk of problems with urinary leakage, problems with erections, or bowel problems. It is also important to understand that most urologists will now recommend active surveillance or monitoring of low-risk prostate cancers to avoid the risks of treatment in appropriate men in order to lessen the concern of overtreatment. So how should you decide if PSA screening is right for you? The most important thing is becoming well-informed and educated about PSA testing for prostate cancer. There are certain men at a higher risk for prostate cancer who should undergo early screening. This includes African American men due to their higher risk of prostate cancer and higher risk of more aggressive prostate cancer. Any man with a family history of prostate cancer, particularly a first-degree relative, such as a father, brother, or uncle, these men are at a higher risk of prostate cancer. Although no definite guidelines exist for these higher risk groups, most experts agree that beginning screening in their 40s would be most appropriate. On the other hand, there are also men who will not benefit from routine PSA screening. These include men who have a life expectancy of less than 10 years. These men do not appear to benefit from early detection of prostate cancer and are much more likely to die of other unrelated causes. This includes most men 75 years or older, men who are younger but have other medical problems that would predict a shorter life expectancy. What if you don't fit either of the above categories? For men ages 45 to 70 who are at average risk of prostate cancer, current information suggests the following. These men should discuss the benefits and harms of PSA screening with their healthcare provider and make a shared decision about whether to undergo testing. These men should consider their priorities and preferences regarding their desire to live longer versus their desire to preserve their quality of life regarding urinary, sexual, and bowel function. They should discuss these preferences with their healthcare provider before testing if possible. They should then make an individual decision about whether to undergo routine PSA screening. In summary, there are advantages and disadvantages to having a PSA test for routine screening of prostate cancer, and there is no right answer about PSA testing for everyone. Each man should become as educated as possible and make an informed decision about whether PSA screening is right for him. At Cone Health, we do offer a community-based prostate cancer early detection program. This program is offered at multiple locations and dates throughout the year as part of our community outreach program. While we feel strongly that the decision to undergo prostate cancer screening is a decision best made as a shared decision process between an individual patient and their healthcare provider, and we encourage all men to discuss prostate cancer screening with their physician, we understand that there are men in our community that do not have ready access to healthcare and men who may have medical providers that do not offer PSA testing. We feel that appropriately aged men who may benefit from PSA testing should have the opportunity to be tested. It is also our goal that men who undergo testing do so only with informed consent and after appropriate counseling and education about the potential benefits and harms of PSA screening. We have therefore created an educational component to our program along with a consent process to fulfill that goal. Furthermore, our program has been designed to follow guidelines recommended by the National Comprehensive Cancer Network and is regularly reviewed and updated to remain consistent with these guidelines. We hope that this information has been helpful to you and will help you be a more informed patient about PSA screening for prostate cancer. Please always feel free to contact us at the Cone Health Cancer Center if you have questions regarding this topic. Thank you.